I'm Larry Brilliant, and I got to welcome you at the beginning of the conference. And today, on the last day, the beginning of the last day, I get to welcome you again. And it's been a wonderful conference. I want to thank you again for coming. And I just want to take a moment to thank Jane Wales for everything that she's done and all of her staff. They've just done a terrific job, and I can just tell you that the Google Charlie's Cafe has never looked so good. So I have, really for me, the greatest honor and the happiest duty to introduce you to my dear friend, Bill Faigy. And I'm going to take a little while to do that because he told me he wasn't going to use all 20 minutes of his speech, and I borrowed some of his time. Bill is truly, I think, one of the great treasures in the world of global public health and beyond that. Any of you who have worked with him know what I'm talking about. The number of times that you meet people who have found that Bill Faigy has touched their life in a deep and a meaningful way is just amazing, and in so many ways. I'm sure when you hear him today, he will inspire you. But it's not just his words that are inspiring. He is a man of great vision. He is a wonderful father, a wonderful grandfather, a wonderful husband, a great friend, and this sounds like a eulogy, which I don't want to do, Bill. Let me rattle off a couple of his accomplishments, and then we'll get back to the eulogy part. Bill was a medical missionary in Biafra, and during that extraordinarily difficult time, he conceived the idea that smallpox, then epidemic in the midst of the Biafran crisis, that smallpox could be eradicated by a novel method of surveillance and containment. It sounds so simple now, like many great scientific insights. Now, through the retrospectoscope, it sounds obvious, but it was a real breakthrough, one of the great conceptual breakthroughs in public health. He then carried that breakthrough to India, where he became the intellectual leader of the WHO smallpox campaign. And then he went to CDC, where he was the head of the Center for Disease Control. He was the president of the American Public Health Association. He was the executive director of the Carter Center. You get the idea. My wife and I had the chance to meet with President Carter and his wife backstage at some event, and we said those two magic words, Bill Faigy. And President Carter said, I couldn't be the ex-president that I am and do the things that I do were it not for Bill Faigy. So Bill now is a senior fellow at the Gates Foundation. He has brought his humor, his quiet dignity, his deep charisma in between those jobs to the field of child immunization, campaigns against cigarette smoking, preventive medicine in general. And I think that I, like many of the people in this room, I know for sure that many of the people in this room have told me, consider ourselves students of Bill Faigy. We'd like to stop just short of stalkers. But we feel like, we come close to crossing the line. And the reason is because of the effect that he has on people. Bill took me to see my first case of smallpox in India. When I was 26 and working in the smallpox program, I was the mascot on the team. And it was my first job out of medical school. And when we went to the village, he told me that, and in fact it did occur, he told me three things. He said that I have never seen a disease as awful as smallpox, that it will be difficult to bring children to be vaccinated, and that he had a foolproof way of doing it because he would go and tell the village headman to bring the children and tell them the tallest man in the world was in their village, and they would come and we would vaccinate them. You have to understand the way that Bill sort of teaches. At some point when I was trying to make my transition between clinical medicine and public health, he said to me, as I'm sure he said to hundreds, "Do you miss clinical medicine?" And I said, "Yes, I do." He said, "Well, what do you miss?" And I said, "The interpersonal contact, the feeling that you're having a direct effect on people's lives." He said, "Oh, that's no problem. Just think of a temperature chart of a child who's got a fever and see the way that it breaks and goes down." He said, "You'll know that you've made the transition to public health when you can see an epidemic curve and feel as good about the downward movement of that curve as you would in the downward movement of a temperature of a child with a fever." And I have to tell you that that has stuck with me all of my life. But it is his humor, it is his way of thinking of things that makes Bill stand out among all other people I've ever met. As we went through village after village in western Uttar Pradesh, and we saw so much death, we saw so many cases of smallpox and death from so many things. We were in a Jeep once, and Bill said to me, "Larry, have you considered the way you want to die?" And I said on that cheery subject, "No, I hadn't." And he said, "Well, I have." He said, "I've thought about it many times. And I've decided that these are the characteristics of my death that I would like to have. First, I want my death to be meaningful. Second, I'd like it to be a time of my choosing, or at least a time when I know that it will occur, so that I could plan to say my goodbyes and put my affairs in order. If possible, I'd like it to be quick and painless." And I said, "Well, how do you do that, Bill?" He said, "Well, I've thought about it a lot." And he said, "I've decided to make it meaningful, painless, quick, and at a time certain. I'd like to be executed." So that's sort of where I got the idea for the eulogy. I can't tell you, it is with such honor and so much pride that on behalf of the Global Philanthropy Forum, and especially for us, Bill, on behalf of Google, it is an honor to welcome you here. Thank you so much for coming.
Well, you outdid yourself again. You want me to use these notes?
Yeah, you can read the notes here.
Surveys have often shown that the single biggest fear of Americans is public speaking. My single biggest fear has always been that someday I will be introduced by Larry Brilliant. A third of a century ago, many of us went to India to work on smallpox eradication. Some went to seek adventure, but not Larry. He went in search of truth. And he continues that journey, searching for truth today. Sometimes he interrupts the journey to babble nonsense, as you just heard. But even that can be fun, and thank you, Larry. Last week I was on a panel in Washington, D.C., and had the chance to talk about how life surprises us. I had gotten on an airplane in Seattle, sat down in the aisle seat, was reading a newspaper. A man excused himself and took the seat next to me. We talked for just a moment. I made a mental note of the fact that he was probably in his 80s, that he had a white beard. And the thing that struck me, he was very unattractive, even for an older man. I went back to reading my newspaper, and 5 minutes later, a woman standing in the aisle, waiting for people to disappear in front of her, tapped me on the shoulder, and she asked, "Are you two twins?" A year ago, our 7-year-old grandson was sitting in the back of the car, and the two of us alone. And I was thinking about how this is an old Greek story, because we see ourselves as going into the future. The ancient Greeks saw themselves as backing into the future because they couldn't see it. And I was thinking, my future is literally and figuratively behind me. And I only get glimpses by listening to the sound of his voice. And suddenly he asked, and I'm not making this up, he asked me, what's the most important thing people could do to make the world better? In some sense, this conference is an attempt to answer the question of a 7-year-old boy. I'm going to suggest 5 ingredients for a partial answer to that question as it pertains to financing global health. Now, it would not be unreasonable to tally the possible sources for monetary funds, in-kind assistance, skills, knowledge, tools, which would be needed to solve the major global health problems. But I'm going to avoid that because there is a more generic question. The problem, of course, is enormous. And if I tell you that 200,000 children under the age of 5 will die this week in the world, it's just a statistic. Until you think that that's about what we lost with the tsunami some years ago. And you will recall this was so important to our country that we sent 2 ex-presidents and all kinds of aid. And then you think that's happening every week with children under the age of 5. This week, next week, every week this year. And look at our response. It's simply not important enough for us to try to change it. But there are some touchstones to keep in mind as we think about an appropriate response. On the one hand, I can tell you I am so delighted by what has happened in recent years with rich people stepping up and saying they want to change the world. In global health, we were always the bottom of the barrel, and we even started thinking like poor people, that we don't deserve more resources. It never would have crossed my mind that a rich person would become interested in global health. And if it had crossed my mind, I never would have thought it'll be the richest couple in the world. If that had ever crossed my mind, I never would have thought maybe they'll convince the second richest person. And so you see how great it is, but then think of the other side of this. Even if the Gates Foundation puts $3 billion a year into global health, even if they do that, that's what we spend on health in this country every 12 hours. And look at the inequities in this country. So it's not that much money. So number 1 of my 5 points, no matter what we do, governments and the marketplace will always be the biggest players. And therefore, long-term solutions are dependent on inspiring government and marketplace involvement. You're all well-versed in the marketplace. But allow me to suggest that when it comes to government, there is a reason why it should be the biggest player. For whatever our criticisms of government, and we have ample reason to criticize, it is the only organization in a country that represents everyone. No foundation, no service organization, no religious group, no corporation represents all of us. Government does and should. Number 2, we've heard this in many ways in the last 3 days. We are all in this together. And that's the key, the actual belief that we are all in this together. This is the concept that dominated the thinking in America during the Second World War, the motto of the greatest generation. And that means everyone. Will Durant, commenting on what happened in this country during the Second World War, raised the question, what would it take to get the world to respond? And he said, the world will respond in that fashion only if it fears an alien invasion. We have now seen that there are some things so powerful that they become surrogates for an alien invasion. Nuclear weapons for sure, but in some sense, that is what allowed smallpox eradication, why we are working on polio eradication, and why we are now suddenly becoming so interested in climate change. These are surrogates for an alien invasion. Issues that force us to see that we're all in this together. And if we are to change global health, We must see this as a common effort. If that actually happens, then decisions on the role of government, corporations, foundations, and so forth become secondary. So it's changing the social norm that precedes funding. We must make this great divide untenable and wrong, incompatible with our sense of civilization. Many have said this in the past. Our own Surgeon General 50 years ago, Leonard Sheely, said the world cannot continue to exist, half sick and half healthy. Schweitzer said it. Gandhi said, my idea of the golden rule is I should not be able to enjoy what the masses cannot. So our first job is to make this a common belief, the social norm. Number 3, and again, we've heard this in various ways over the last 3 days, coalitions. The world is so complex that nothing can be done by a single person or a single organization. It's not a new thought. Polybius, 2,000 years ago, said things in the past may have happened in isolation. But he said, from this time forth, the world must be seen as an organic whole. 2,000 years ago, and he gave examples of things happening in Africa that were now impacting Athens. Everything affects everything. To do anything, therefore, requires a coalition, and leadership in anything, including global health, is no longer found in a title, whether that be director of WHO or president of the United States or billionaire. Leadership is found in the person who can assemble an effective coalition. What are the emerging rules of successful coalitions? First and foremost is a clear vision of the last mile that will result from the coalition. People will not invest their time just because it's nice to improve the health of someone else. There must be, in the words of Gary Wills, a certain trumpet. And he takes that title of his book on leadership from a Bible verse that says, if you hear an uncertain trumpet, who would gird for battle? So in global health, we must be as certain as were the abolitionists when they said the system of slavery was wrong and that it was possible to abolish it. We need to be just as certain that the current system is wrong. To not use the tools and skills and knowledge of science and medicine for all is a declaration of slavery for some. We are willing to condemn others to an enslavement that we would not impose on our own families. We have to be so clear of what that last mile looks like and that it can be achieved. Norman Cousins, in an editorial for the bicentennial, asked the question, what's the greatest gift the U.S. has given the world in 200 years? And his answer was, the greatest gift is the understanding that it is possible to plan a rational future. And we have to sell that idea that it's possible to have a rational future in global health. That the vision of our forefathers 230 years ago for a new country can be matched now with a vision for a new world. And only then, after we have an absolutely clear last mile of global health equity, is it possible to define the first mile of the journey, to figure out the resources needed and how we will get there. Gene Case said yesterday that the same old way isn't going to get us there. Number 4, re-ask the question continuously and in various ways. What do we hope to achieve? What should the last mile look like? And then play with different answers. Richard Feynman, the great physicist, was looking in the mirror one morning, and suddenly it struck him that the explanation physicists had always given for why left and right are reversed in the mirror could not possibly be true, or top and bottom would be reversed also. Now, I suspect physicists are more egotistical than most of us, so they probably look in mirrors more often. And yet every physicist that had ever looked in the mirror had not thought of that. And it caused him to look again at what happens when you look in the mirror. Our oldest son, David, said to me one day when he was very young, "I wish I could see you for the first time." And I asked him, "What do you mean?" He said, "Well, my friends tell me you're so tall and I don't notice that, but I wish I could see you for the first time." And that's what we have to keep doing. Look at global health for the first time and see if it changes the question. We had hints of this on Wednesday with the example, what would happen if we could put a price on carbon? Another example, though, is look at healthcare in the United States. We've gotten ourselves in a terrible situation, and yet we've been stuck for decades asking the same question. How do we balance quality, cost, and access? And it keeps getting us to the same answer. Simply changing the question from how do we balance quality, cost, and access to how do we balance quality, cost, and outcome suddenly changes everything. Because it means we have to measure health outcomes. If we can't measure them, we're in a strange business. And if we can measure them, we could now have the marketplace pay for health outcomes. And what would happen? Suddenly, insurance providers would be trying to enroll sick people rather than well people, because that's the way they would make their money, is by improving health outcomes. And suddenly, you would have to have prevention in the medical care system. Or look at the example of eradication. For years, we used to ask the question, which diseases could be eradicated? And we would go through them. And then 15 years ago, we simply changed the question at the Carter Center. And we didn't ask which diseases could be eradicated. We asked the question, what are the barriers to eradication of this disease? And we went through hundreds of diseases, and what did we end up with? A research agenda for every disease. So what are the critical barriers? In global health, we need to ask, what are the critical barriers to health equity? How do we incorporate everyone, and especially government? How do we use the marketplace to the maximum? How do we detect when the marketplace is not working, as, for instance, with tobacco, and correct it? How do we provide the global leadership that says we're all in this together and for the long term? Back to Will Durant and the concept of an alien invasion. We need to make AIDS and avian flu and polio and infant deaths and maternal mortality surrogates for an alien invasion. We have to develop better incentives for the business community. I think what corporations have been doing in global health recently is one of the great chapters in global health. Merck and Mectizan giving hundreds of millions of treatments free. Glaxo giving albendazole for lymphatic filariasis. And we heard yesterday from Steve Case that we have to have people who are proud of working for their companies because of what the company does. Let me give you one quick example. With guinea worm in West Africa, it requires filtering water to take out the water flea. A division of DuPont at that time called Precision Fabrics came up with a brand new synthetic material that would do this and would not fall apart after repeated washings. They donated the first 1 million square yards of this for guinea worm, and then they became so proud of what they were doing, they continued donating it. They only make this cloth one day out of every few months. On that day, absenteeism goes down. People feel proud to work for a corporation that does these things. There are ways that we can come up with improving what they do. Number 5, understand the generic forces behind poor health. And the biggest one, of course, is poverty. Many of us in this room regard ourselves as rich, but we make no protest over the fact that the poor are subsidizing us. Food is cheaper. Our rooms are less costly at the Sheraton because people are working at minimum wage. The same thing is true for poor countries. Part of my wealth is accumulated on the backs of sick women in Africa, and I should be troubled by that. Part of my wealth is subsidized by the future. I will never repay my carbon debt. Someone in the future will have to do that. I will never even repay my part of the national debt. My grandchildren will be doing that. William Wilberforce did not end slavery 200 years ago when he finally succeeded in getting Parliament to stop the slave trade. But he ended the idea that it was okay to have slavery. The slavery of those living today and in the future, slavery imposed by poor health, global climate change, and poverty, is condoned by many as necessary for business. They aren't willing to protect the environment because it would be bad for U.S. economic growth. We are the slave masters and must be willing to say that with force and clarity. We have the job that Wilberforce had 2 centuries ago to change the social norm, say it is wrong, it is evil to enslave the future to satisfy our economic appetite. In the parlance of the day, it's not a few bad apples, it's a bad barrel we live in. People in this room don't need to be convinced, but you do need to be convinced that you have to play a role in getting the rest of society to think this way. It's not just that we need wise leaders in our country. We need every voice in this room saying this is what is needed for global health. So in closing, I come back to the single major message in how to finance global health. If we're to change global health equity, we must change the social norm to a common understanding that inequity in health is a form of slavery. And in the words of Primo Levi, when you know how to relieve torment and don't, then you become the tormentor. When we believe that, the funding will be easy. And we can answer a 7-year-old who asks, what is the most important thing people could do to improve the world? Thank you. Thank you. Could I ask our panel to come up, please?